Welcome to this presentation about Lyme and tick-borne illness prevention, brought to you by Bay Area Lyme Foundation. This presentation will take approximately 15 minutes and includes an overview of Lyme disease, how ticks transmit disease, information on the symptoms of Lyme, how to recognize when you are sick, and tick bite prevention information. Tick-borne diseases are on the rise throughout the United States and the world. Although this is a matter for debate, many people believe this may be a result of changing climate. Ticks are being found in countries and regions of the U.S. where they were previously unrecorded, and testing ticks has shown that some species of ticks are now carrying different bacteria, viruses, and parasites. It is often very difficult for healthcare professionals to diagnose tick-borne infections, and misdiagnosis and mistreatment is, unfortunately, very common. People who work in the outdoors are at high risk of infection since they are exposed to tick habitats as part of their jobs. These are just 3 of the numerous ticks present in the United States that can transmit diseases to humans through a bite. One tick can carry multiple bacteria, viruses, and parasites, so it's possible for someone to develop not just one type of sickness, but what we call co-infections too. This makes tick-borne infections additionally complicated for doctors to recognize, diagnose, and treat. The symptoms of Lyme can often look like other diseases or minor illnesses, and therefore mask the real root of the person's affliction. If left untreated, or if treated with the wrong medications and approach, tick-borne infections can be severely debilitating and even lead to death. This slide shows the difference in size between an adult female black-legged tick on the left and nymphal, or a teenage tick, on the right. This photo gives you an idea of the scale of ticks depending on where they are in their life cycle. Nymphal ticks can be the size of poppy seeds or sesame seeds. Larval ticks that are just hatched from eggs are even smaller than nymphal ticks and almost impossible to spot with the naked eye. Our next slide will explain a tick's complete life cycle. A tick lives for approximately 2 years. It has 4 life stages: egg, larva, nymph, and adult. It has to have a blood meal in order to develop to the next stage of its life cycle, so its natural drive is to feed and breed. Ticks are opportunistic. They simply hang out and wait for an animal to pass by. Then they attach themselves to that animal, feed for about 3 days, then drop off and transform to their next life stage. If they feed on an animal that is infected with any kind of bacteria, virus, or parasite, they may then pass on those pathogens during their next feeding. The adult female black-legged tick is the most easily identified tick due to her dark red body, but it is the nymphal tick that are the most dangerous to humans. They are very numerous and tiny. This makes them very difficult to detect, and a much larger percentage of the nymphal tick population is infected with the Lyme bacteria. This is why the springtime or nymph season is so dangerous for anybody who works in the outdoors, since it's the time people are most likely to get bitten. So where is the Lyme bacteria coming from? The bacteria resides in the blood of wild animals, including squirrels, mice, rabbits, birds, and deer. These infected animals are what we call the bacterial reservoirs. The ticks that live in the leaves, grasses, shrubs, trees, and under logs feed on these wild animals. If an animal they feed on is carrying the bacteria, the tick then becomes an infected tick. If the now infected tick subsequently feeds on a human, it may transmit the infection to that person. Because ticks are so small, people diagnosed with Lyme often report never having seen a tick on themselves or even being aware of a bite. When we look at this slide of a nymphal tick, it's easy to see why ticks can be missed with the naked eye. The larval ticks are even smaller. Sometimes an embedded tick can be mistaken for a freckle or skin tag and simply ignored. The fingertip test, running your hands across bare skin while showering, is often the best method of detecting when you have a tick embedded in your skin. Lyme is an ancient bacteria that has adapted over millions of years. As we have learned, the bacteria that causes Lyme is transmitted to humans by an infected tick bite. However, the time it takes for the bacteria to be transmitted to humans can vary, so there is a lot of debate around what's a safe time for a tick to be attached to a human. Although many medical entities state that a tick has to be embedded for over 24 hours for infection to occur, unfortunately, many people have reported getting sick inside this window of attachment, so it's best to err on the side of extreme caution. At Bay Area Lyme Foundation, we believe that there is no safe time for a tick to be embedded in your skin, and it should be removed immediately. In 1975, a cluster of what was then thought of as juvenile rheumatoid arthritis broke out among teenagers in Lyme, Connecticut, hence the disease's name, Lyme, but the actual bacteria wasn't identified as the cause of the disease until 1982. In the early stages of infection, Lyme disease is characterized as an acute flu-like illness. Lyme disease is the fastest-growing vector-borne disease in the U.S. today, with cases reported in all 50 states. What is a vector? A vector is an animal or insect that passes a disease from one animal species to another, like a bridge between species. There are an estimated 330,000 new cases of Lyme annually in the U.S., according to the CDC, and many consider this to be an epidemic. People who work in the outdoors are at particular risk for Lyme and tick-borne infections, as their jobs bring them into daily contact with tick habitats. Tick season is year-round in California and where winters are mild, and varies by region. Here you can see how a tick that has been feeding for a few days is a lot easier for a person to detect. As it feeds, the tick swells up with ingested blood. There is a lot of debate around how long a tick has to be attached to a person before we should be worried about disease transmission. There is some evidence to show that the Lyme bacteria may take up to 24 hours to get activated and move from the tick through the mouthparts and into a person's bloodstream. We definitely know that the sooner a tick is removed, the less likely it is for a person to get infected. Studies have shown that disease-causing bacteria can reside in the tick's saliva, and some bacteria that can cause infections may even get transmitted in as little as 15 minutes. The Lyme bacteria may penetrate bare skin, so never squash a tick on your skin with your bare hands. There are distinct visual signs of Lyme disease which can help with diagnosis when these are accompanied by other flu-like symptoms in the early stages of the disease. An expanding red rash can appear at the bite site 3 to 30 days after the bite. The rash can have many shapes. It may be round, oval, triangular, and irregular in shape. These rashes are typically not itchy or painful, but this can be further complicated by the fact that some people can have an allergic reaction to tick saliva, and in this case may itch. An allergic response will usually happen within 24 hours of a bite, and the rash doesn't usually spread or expand. It is very important to note that not everyone gets a rash when they are bitten. Studies show that somewhere between 30 to 40% of Lyme patients got no rash at all. Be alert to any kind of rash if you have been working outdoors in tick habitat. Here on the left, you can see the classic bullseye rash, which is most often recognized as being a key indication of a tick bite. However, on the right, you can see a more common rash with no clearing. This may be harder for a doctor unfamiliar with Lyme to diagnose as being a rash from a tick bite. A Lyme disease rash typically moves or spreads outwards from the bite site, so pay attention to rashes, and if they move, expand, or you get clusters of rashes on your body, go to the doctor. One way to prevent Lyme disease is to be aware of the symptoms of the disease in its different stages. Within days of exposure, people will typically come down with a very bad flu-like illness. They may experience headaches, fever, muscle aches, chills, fatigue, joint pains, and their lymph nodes will be swollen. These symptoms, especially if accompanied by a rash, should be enough to send you to the doctor immediately. As the disease progresses and the bacteria migrates to the deep tissues of the body, people begin to experience more debilitating symptoms: arthritis in one or more joints, nervous system problems, shooting pains, tingling, and sudden facial drooping like Bell's palsy. About 10% of people begin to get heart problems, and irregular heartbeat and palpitations are reported in some patients. If heart symptoms are experienced after a tick bite or rash, emergency medical treatment should be sought. If left to progress, the disease will then develop further. 60% of patients will have very severe joint pains and swelling and develop neurological complaints. Brain fog is a common complaint as people struggle to function and recall information. This phase of Lyme is extremely debilitating, and people are often unable to work or manage their day-to-day lives. It's therefore very important to catch the disease in the early stages. If treatment is delayed, the bacteria migrates to deep tissues of the body, including the heart, lungs, and brain, and is much harder to eradicate or treat effectively. If you know you have been bitten or suspect Lyme based on developing symptoms, you should go to your doctor immediately. Early treatment is absolutely key in preventing any tick-borne infection taking hold. If you are prescribed antibiotics, you must complete the course. You should continue to monitor yourself for symptoms after completing any medication, however, as Lyme symptoms can persist even after treatment. Preventing Lyme disease is a combination of education, awareness, and action. Protecting yourself and staying safe while you are working is always your number one priority. First, be alert to ticks. If you are working in brush, long grasses, and woodland areas, always be aware that you are in tick habitat. Know when tick season is in your region. Is it spring through fall or year-round? Remind yourself of the dangers of tick bites through visual reminders in your work vehicles and gear. If you see a tick on a coworker, let them know immediately. Remove the tick right away. If you or a worker get bitten, know what to do. We'll cover this in a later slide. The cheapest and simplest way to prevent tick bites is to treat all your work clothing and gear with permethrin. Permethrin is a chemical that is harmless to humans but kills ticks. You can purchase spray-on permethrin online or from outdoor gear providers. Spray the permethrin on dry clothing till damp, then allow the clothing to air dry. This gives protection for up to 7 washes. If you plan to treat a large volume of clothing, you can buy containers of concentrated permethrin, dilute it with water, and then soak clothing in this solution overnight. Always follow the manufacturer's instructions when using permethrin. In addition to treating clothing, you should always wear an insect repellent on exposed skin. Doctors recommend using a repellent that contains at least 20% DEET or picaridin in order to be effective. If you are concerned about using DEET or insecticides on your skin, explore alternative repellents, but be sure to visit reliable sources for information on the effectiveness of the formulas. Lemon eucalyptus oil has been shown in some studies to be as effective a repellent as DEET if reapplied frequently per manufacturer's recommendations. Remember, repellents will not kill ticks and will not provide protection unless used correctly. You can also purchase clothing that is pre-treated with permethrin. The technology is safe for humans and highly effective. Ticks die on contact with fabric that has been treated with permethrin. The U.S. military has been using uniforms treated with permethrin for its ground troops since the 1980s, and treatment in the fabric will last up to 70 launderings. Your clothing will also repel other biting insects, like mosquitoes, biting flies, chiggers, and mites, offering a greater degree of comfort and protection when you are working. When you shower at the end of the day, this is the best time to check for ticks. Use your fingertips to feel your body and investigate anything that feels like a bump or skin tag that wasn't there the day before. As ticks crawl up after they land on your body or clothing, they are most often found in the following areas where they will have hit a point of constriction or just an optimal site to embed themselves: head or hair, ears, folds of the neck, armpits, waistband, groin, and backs of knees. You should also check your pets, as ticks can be savvy hitchhikers and get into your home that way. Remember to check for ticks every day. Knowing how to remove a tick correctly is important for the health and safety of you and your coworkers. Using a needle nose or pointy-tip tweezer, grasp the tick as close to the skin as possible behind the head of the tick. Pull firmly but gently away from the skin. Do not twist or yank at the tick. This may shock the tick into regurgitating the contents of its mid-gut into the bloodstream, the exact opposite of what you are trying to achieve. If the tick is large enough, like an adult or swollen tick, you may use a special tick removal tool. Be sure to follow instructions exactly. No other method of tick removal is recommended. Also, you should never squash a tick or squeeze it with your fingers. You should save the tick for testing by putting it in a small Ziploc baggie with a moist cotton ball. Testing ticks is the best way to know if you have been put at risk of infection and is highly accurate. You can find out more information about tick testing by visiting Bay Area Lyme Foundation's website. Let's summarize our prevention and action tips. If you find a tick, remove it immediately. Save the tick for testing. Treat all of your clothing with permethrin, as it kills ticks on contact. Use at least 20% DEET or picaridin insect repellent on all exposed skin. Wear long-sleeve shirts and pants. If possible, wear light-colored clothing, as ticks are easier to spot. Tuck pants into socks and long hair up into a cap or hat. If you've been out in tick habitat, watch out for yourself and your colleagues, and always monitor yourself for symptoms. Wearing lighter-colored clothing can help people spot ticks more easily. Also, wearing long pants and long-sleeved shirts when out in the field is strongly advised. Tucking pants into socks can help prevent ticks from crawling up pants' legs. In addition, ticks can survive being washed, but they cannot survive the dryer. If you run your clothing through the dryer on the hottest setting for 15 minutes when you get home, the hot, dry air will kill the ticks. Note, Do not do this if you have been working around plants and foliage with poisonous oils, as this will spread the oil into the dryer. We hope that you have learned important information about Lyme and tick-borne diseases in this presentation and that you will stay safe in your work. Continue to educate yourself and your colleagues about Lyme disease and tick-borne infections by visiting our website at www.bayarealyme.org and signing up for our quarterly newsletter. Thank you for your time.